Cardiovascular diseases are the leading cause of death globally. It is said that an estimated 19.8 million people died from cardiovascular diseases in 2022, representing approximately 32% of all global deaths. Of these deaths, 85% were due to heart attack and stroke. Heart attack is a cardiovascular disease, and stroke is also a vascular disease, cerebrovascular disease. So, over three-quarters of cardiovascular deaths occur in low and middle income countries, which include Nigeria. Out of the 18 million premature deaths under the age of 70 due to non-communicable diseases in 2021, at least 38% were caused by cardiovascular diseases. This is from the World Health Organization. And then it went on to relate some important factors. Examples of these cardiovascular diseases include coronary heart disease, which is a disease of the blood vessels that supply the heart muscle. We have cerebrovascular disease, a disease of the blood vessels supplying the brain, which is often referred to as stroke. We have peripheral artery disease, a disease of blood vessels supplying the arms and the legs. Then we have rheumatic heart disease, a damage to the heart muscle and heart valves resulting from rheumatic fever. A rheumatic fever is caused by streptococcal bacteria. We have congenital heart disease. These are birth defects that affect the normal development and functioning of the heart caused by malfunction of the heart structures from birth. And we have deep vein thrombosis and pulmonary embolism, where blood clots form in the leg veins, and this can dislodge and move to the heart and lungs with catastrophic consequences. What are the risk factors? What are those things that could put us more at risk for cardiovascular disease? So, the most important behavioral risk factors of heart disease and stroke are unhealthy diet. Unhealthy diet that has a lot of salts, a lot of fats, that has a lot of sugar, physical inactivity, lack of physical exercise, tobacco use, and harmful use of alcohol. These are some of the risk factors for cardiovascular diseases. Then also we have environmental risk factors like air pollution. The effects of these risk factors are shown in the person having raised blood pressure, having hypertension, raised blood sugar, having diabetes, having raised blood lipids, blood fats, which is called dyslipidemia, and overweight and obesity. So these ones are now referred to as intermediate risk factors, and put one at its increased risk of having cardiovascular disease. So the primary risk factors are the main risk factors are unhealthy diet, physical activity, tobacco use, and harmful use of alcohol. These ones can now lead to intermediate risk factors, which include hypertension, diabetes, raised blood lipids, blood fats, and overweight and obesity. So these things now will now put you at increased risk of cardiovascular diseases, which include heart attack, stroke, heart failure, and other complications. So what are those things that can help us? So when knowing these risk factors now, there are things we can do to help us reduce these risk factors, like cessation of tobacco use, stopping the smoking of cigarettes, stopping the use of tobacco will help to reduce the risk factors. It helps reduce the risk of cardiovascular disease. Then reducing salt in our diet is also very important. Eating more fruits and vegetables is also important. Regular physical activity is important. Avoiding harmful use of alcohol. Harmful use of alcohol involves taking more than the recommended level of alcohol. So these things, stopping use of tobacco, reducing salt in the diet, eating more fruits and vegetables, engaging in regular physical activity, and avoiding harmful use of alcohol will reduce the risk of us developing cardiovascular disease. So these are the things that you should bear in mind. And another thing is that, so one other point here you should note is that, why are cardiovascular diseases, why is it a development issue in low and medium income countries like Nigeria? He said that approximately 80% of the world's deaths from cardiovascular disease occur in low and middle income countries. People living in low and middle income countries often do not have the benefits of primary health care programs for early detection and treatment of people with risk factors for cardiovascular disease. People in low and middle income countries who suffer from cardiovascular disease and other non-communicable diseases have less access to effective and equitable healthcare services which responds to their needs. So all this one leads to late detection of these conditions that can lead to development of cardiovascular disease. A number of things are mentioned here. So one thing you should note is that it's important to it's important to go for checkup. It's important to go for checkup. It's not only when you are sick that you go for checkup. There are some things that should make you go for checkup. One of the things that is recommended, according to the United States Preventive Services Task Force guidelines, if you are above 18 years and above, and you don't have hypertension, you should go for office blood pressure measurement, meaning that you should go to a hospital or go to a clinic or health facility where your blood pressure can be measured. So if you are 18 years and above, have you checked your blood pressure before? If you haven't checked it, please do. When it's checked, if there are issues with it, then you can meet a health professional to help you. And then if after the initial BP, the initial blood pressure check, if it is okay, he said that is one of the recommendations, if you are 40 years or older, you should be checking it every year. So if after the first BP you checked it's okay, it's normal, then if you are above the age of 40, you should be checking it at least once a year minimum. You can check it more than once a year, but at a minimum once a year. Then if you are less than, especially if you are black, if the BP you have, even if it was normal but it was high normal, it was on it's a range. So if it's normal but it's getting close to being abnormal, that should also make you want to check it. Then those who are overweight or obese should also check their BP as well, of course, of risk of hypertension. But if you are between 18 and 39 years and your first BP was okay, and you don't have all these risk factors that we've mentioned, you can be checking it at least 3 to 5 years. I would recommend, since you are living the environment we live in, and you've noted that 80% of the cardiovascular diseases, deaths from cardiovascular diseases, are happening in low and middle income countries like Nigeria. So it's good if you're an adult, you're above 18 years, you should always check your BP at least once a year. Then if you have a family history of hypertension, there's someone in your family, your parents, your siblings, a close family member, if they have hypertension, a close blood relation, let's put it that way, a close blood relation, if they have hypertension, then you should be checking your blood pressure at least once a year or more than once a year if you can. Another thing you can also check is your blood sugar level. It's also important. So persons who don't have symptoms of diabetes, but are aged between 35 to 70 years, that are overweight or obese, to check their blood sugar level. So one of the things you should note, that if there's a family history, any of your parents having one of these conditions like hypertension or diabetes, or conditions, all the fads, one of your parents have stroke or heart disease or kidney issue, kidney disease, you should want to go and check your blood pressure and check your blood sugar, which are things that could lead to that. Another thing is that if you are overweight or obese, the way we know whether you are overweight or obese, we check your height, check your weight, and we measure what we call BMI, body mass index. Check the body mass index, BMI. So the BMI will now tell us whether you are overweight and whether you are obese. Then if you have history of tobacco use, of using tobacco, you know that you are at risk. If you have unhealthy use of alcohol, the harmful use of alcohol, excessive use of alcohol, you should also go for checkup. If you have sedentary lifestyle, lack of physical activity, lack of exercise, you should also be wary. Then if your diet consists unhealthy diet that has a lot of salt, sugar, fats, then you should also check. So the death of this deputy governor should be a call for us to, if you're an adult, if you have a family history, if you're overweight, you're obese, you should go for a checkup. That is quite important. And then when you go for checkup, if these things are checked, if they are okay, then at least once a year, minimum of once a year, you go again for the checkup again to see whether there is any change. Then if you have certain complaints, something to suggest that you may have one of these cardiovascular diseases that I've mentioned, you go for checkup. You understand? If you have a close blood relation that has one of these conditions, then you should go for checkup. You check these things more frequently. These things are important. Interesting thing to note is that hypertension is referred to as a silent killer. So it will not always give you signs. You may not know that your blood pressure has gone high until you check it. That's when you know. You understand? You may not know that you are pre-diabetes. Pre-diabetes is your blood sugar has not gotten to the diabetic range, but it's within the borderline, is tilting towards diabetes. So you may not know, you may not have symptoms to show that you are pre-diabetes, and so you may not take the steps to prevent you from getting diabetes. So the only way you can know that is when you check your blood sugar level. That's when you know that you are pre-diabetes. You understand? So some of these things will not always come with symptoms. You may not know. And that is why you see that if you come to the hospital, especially general hospitals, teaching hospitals, when after paying to see the doctor, after paying for consultation and all that, the next step is that you check your blood pressure. Sometimes some people wonder, why is my blood pressure being checked? What brought me has nothing to do with blood pressure. Please note that your coming to the hospital is an opportunity for us to check, not just for what brought you, to check for other things. That is why we refer to it as screening. That is a screening process. Everybody that comes for consultation and you're an adult, you check your blood pressure. So anytime you come to the hospital, if they want to check your blood pressure, please take advantage of it. And if they don't check your blood pressure, ask the nurses that my blood pressure has not been checked. I want to know my blood pressure. What is my blood pressure? Is it okay? Then when you now eventually see the doctor, please remember to ask the doctor, doctor, how is my blood pressure? Is it okay? Because sometimes if maybe you came to complain that your leg is paining you, and you go in, you are seeing the doctor and you say, doctor, it's my leg that is paining me. Your blood pressure may be high, but because the complaint you have has taken the attention of the person that is seeing you, so they may not pay attention to the blood pressure. So by the time you ask the doctor, the health worker that is seeing you, ask the person, how is my blood pressure today? You should now make the person go and check the record and see what was the blood pressure that was measured by the nurse. So you now check and now say, oh, your blood pressure is okay. Sometimes you now check, this your blood pressure, this your blood pressure is not normal. Sometimes they could even request for you to go back and have another check of the blood pressure, just to be sure if it's okay. So when you come to the hospital, it's an opportunity for you to be screened for things like hypertension. And it doesn't matter what brought you. And it doesn't mean that once they check the blood pressure and it's abnormal, then they'll start giving you drugs right away. No, there's a process to it. If the blood pressure is high but it's not too high, and it's the first time your blood pressure is being checked, we could give you a follow-up time to come back for your blood pressure to be checked again. And if you are giving such an appointment, please follow it up. Usually, if the BP is not too high, we want to check it again on another date. It's when the blood pressure is persistently high, that will now say you likely have hypertension, high blood pressure. So when your blood pressure is checked and you have to come back in a few days or in another week or in 2 weeks, please make sure you go back. And anytime you come to the hospital and you see that there is a nurse there, there's a health worker there that's checking blood pressure, please always make sure they check your blood pressure. And if you can get a piece of paper and say, please write the blood pressure for me. I want to know what my blood pressure is. I'm not going to go into the specific figures and all that because it will make the video too long. The point is that you should be conscious, you should be aware, you should be concerned about what is my blood pressure. So that you can now ask questions and you will now make the health worker or the doctor or whoever is seeing you to look at what the blood pressure is and advise you accordingly. Then also, you can also have your blood sugar checked. The blood sugar is not always checked routinely. It's not every time you come that you check your blood sugar. Usually, if the person has symptoms, there are symptoms of diabetes. Commonly, they could come with excessive passage of urine, polyuria, excessive intake of water, polydipsia, excessive taking of food, polyphagia. They could have weight loss. So when you have excessive passage of urine, like waking up several times in the night to pass urine, call it nocturia. When you have those symptoms, one of the things we check for is diabetes. Then if you have a family member, either your brother or your sister or one of your parents, or if you are old enough, if you have a child that is diabetic, then you too could be at risk as well. So you can also have your blood sugar checked if there is family history, and then if you have symptoms. And then when the results are out, there are ways we analyze the results. There are things sometimes you may be asked to do further tests, or sometimes you may be asked to do a repeat of that blood sugar test. You may be asked not to eat for a minimum of 8 hours or fast overnight before the sugar test is done. Please, it's important. Sometimes you find that if you give some tests to some people and they say you avoid doing the test, or they may think that, oh, my problem is typhoid and malaria. It's not everything that is typhoid and malaria. You see somebody that the sugar level is high and you're telling the person this sugar level is what is causing the problem you have. The person say, what about typhoid and malaria? Or in some instance, they will feel that the person has some spiritual or psychological problem, and say, oh, this thing is, they will tag it with a name. Even when the blood sugar is high, and even though the person is coming down with complications of diabetes. So it's important that we have these things checked. And whenever we check it, we should make sure when these things are checked, we see a health professional to interpret the results. That's important. A health professional who is trained to be able to interpret the results. There is some results, we could ask you to repeat them at another time or in a place different from where you did the initial test. Sometimes if it's blood pressure, we'll ask you to check it again. There are sometimes some people will complain that, oh, it's only when they come to the hospital that their blood pressure is high. If you have blood pressure measuring device at home, it can be used. You can bring the device to the hospital so that you can be taught how to use it properly. Then if there is somewhere close by to your home where the blood pressure can be checked, you make a record of your blood pressure measurement, then you still take it to the hospital where the blood pressure will be checked again in the hospital and now be compared to what you got at home or what you got in the environment where you live. All these points are quite important. Whether you are a health professional or whether you are not in the health field, it's always important that we go for checkup. And when we go for checkup, it's important to seek the advice of a health professional who will give us appropriate advice on what is normal and what is not, and if there is need for you to come for repeat check, and if you have to come for regular visits. There are some people that are hypertensive, some are diabetic, and they are just taking the drugs at home. When the drug finishes, they go and buy without coming to the hospital, without coming for checkup. That is not encouraged. It's encouraged that you come to the hospital at regular intervals. Initially, it could be once a month. Then if there is improvement in your sugar level, your blood pressure level, then the duration of your visits, the interval can be increased from 1 month to 2 months, and sometimes once in 3 months. It's important you seek the counsel, advice, the direction of a health professional, so that you don't do self-care or self-medication or self-management, rather to seek the the counsel, advice, and direction of a health professional. All those things are important so that we may be having an underlying issue and will not be aware. We may feel okay, but it's only when we come to for checkup and we are checked, we are asked to do some tests. That is the only time we, we may find out there is a problem. And if there is a problem, like the drugs are available for hypertension, for diabetes, for lipids problem. If there is problem of weight, advice on lifestyle changes and all that. So there are common things, easy things that can be done that can be helpful, but we won't be wiser to know to start these things if we don't come to the hospital for checkup. So that's important.